barrier that the guardians may have with the children, or they may not be able to help thoroughly with some of the homework. And so as a guardian, as a parent, having to deal with some of that emotion that comes through, we also have been helping parents through dealing with those. So those are just a couple of things that come to mind. But in addition, just what Dr. Castro had mentioned, just we see different generations that are living in one household, and not being able to isolate within the same home can cause a lot of just feeling of guilt. If I pass the virus to my family member, or to my grandma or to my great grandma, the guilt that I would feel as living in a Latino multi-generational home.
Thank you, Andrea. That was a great overview. So Tim, our community would like to know, if I am experiencing symptoms, how can I know if it is depression or anxiety? And if that's the case, what should I do?
Certainly. I think that I'm highly confident that we all are experiencing some level of anxiety and some level of depression. Emotional reactions are expected and are a normal part of the process when we have traumatic events like this. Many people may experience feelings of fear, guilt, anxiety, sadness. They may experience insomnia, fatigue, and anger. And furthermore, these feelings can result in negative behaviors such as irritability, being oversensitive, being hostile, and even being short-tempered. Again, I think it's important that we remind ourselves that these are all normal, and it's important to recognize that others may be having these same feelings. So providing a little grace, a little kindness, and understanding to one another is more important today than ever before. There are some basic ways that you can try to cope with these symptoms. A couple of examples could be to ensure that you structure your days and your weeks, to routinely check on your friends, family, and coworkers, to give yourself permission to feel down, to realize that it's okay not to be okay, to talk about your feelings with one another, to exercise and make sure that you're meeting your essential nutritional needs, drink plenty of water, and avoid using substances as alcohol or drugs for coping. It's even more important that if these feelings or symptoms of anxiety and depression get in the way of your daily activities for several days in a row, or you start to experience new symptoms that are impacting your ability to work or to interact with others, or if you're having thoughts of suicide, you should seek professional help immediately. If you or someone you care about is experiencing these symptoms for this period of time and are in a mental health crisis, you can call our 24-hour crisis line at Johnson County Mental Health at 913-268-0156.
Thank you, Tim. We appreciate those resources. Dr. Murat, we have heard about new variant strains of COVID. Will the vaccine protect us from those variants?
So that's an excellent question, Mariana. And the answer is we don't quite know yet. And so there have been some variants that have popped up in South Africa. And so that's really the big question. With the Moderna and the Pfizer vaccines, we know that they are 95% effective in decreasing sickness due to COVID. But the main worry that is out there amongst experts is what will happen, or how effective will these or other vaccines be against the variants. There's not a lot of evidence, and I would invite my other colleagues to weigh in as well, but there is not enough evidence at this time to know for sure how the vaccines will, how effective they will be against variants. And so that's just one of the reasons why, even if someone is vaccinated, it is very important to still wear a mask and socially distance.
Thank you. Is there anyone else who wants to chime in, or should we go to the next question?
I can, I second what Dr. Murad said. I agree 100% that, this is what all viruses do. When there is pressure, the virus mutates. And so this happens with other viruses that we do on an annual basis. And the surveillance is the critical part here, is for us to understand what those variants are in our community. And then as we test against these variants, then we can see whether or not they are causing either more susceptibility or more infectiousness, or are they causing increased disease severity, or do they alter our protection against those viruses? There is one variant so far, the UK variant, which appears to be the B117 variant, which appears to be cause more severe disease. But we believe at least some data suggests that the Pfizer vaccine is effective against it. So right now we do have effective vaccines against even the variant that is more virulent at this point.
Thank you, Dr. Castro and Dr. Murad.
May I add one thing, Mariana?
Yes, please.
Thank you. I just wanted to say one other thing. Everyone is doing such a great job with this answer. But I also want to say that the way that the vaccine mutates is the opportunity for it to mutate comes every time that it spreads from person to person to person. And so it's just becoming very important, I think, to consider becoming vaccinated, to consider getting that vaccine, because the faster we can stop the spread of this virus, the fewer opportunities that it has to change and to mutate and to become even scarier. So just a note about why we're pushing everybody to really consider vaccination for themselves and their families. Thanks.
Thank you, Dr. Corvo. And while you're there, could you tell us what are the side effects of the vaccine, and if receiving it would impact someone's fertility?
Oh, sure. Well, the side effects from the vaccine really that we're seeing most often is pain and swelling at the site of injection. It's very similar. It feels very similar to a flu shot. When you get the injection, sometimes it hurts for about a day or so. Sometimes people have other reactions that last for maybe 24 hours or so that you can feel throughout the rest of your body. And really what I mean by that is like headaches. Some people feel tired. Some people even get a fever or feel chilled. But I don't want you to be alarmed if you get any of those symptoms. That's normal sort of side effect that we feel very often from a vaccine like this. And probably means that your immune system is working well, actually. Regarding the question of fertility, no, the vaccine does not affect your fertility at all. And so it's an interesting rumor that has been spreading. And historically speaking, during other vaccination campaigns in our history, for instance, the polio vaccine and others, there have been rumors about fertility as well, but we know that they don't affect fertility, and this one doesn't either. So I don't want you to be worried about that.
Thank you, Dr. Corvo. And the questions that we're asking, like Padre Gianni said, these are pre-submitted questions from community members, but we're also going to try to leave at the end some room for questions. I'm already seeing several questions in the chat here, so we're gonna try to do our best to get to those too. So our next question is for Dr. Lee Master. After the second dose of the vaccine, can I still be a carrier of the virus and infect other people?
Thanks. This is a great question. The answer is we're still not sure about this because research is still ongoing about this. The original vaccine experiments that developed the COVID vaccine studied whether people who are vaccinated develop the severe forms of COVID, whether they became symptomatic or not. We know when we say that the vaccine is 95% effective after 2 doses, what we mean is that that there are about 95% less severe illnesses or severe cases of people with who 95% less among people who get vaccinated compared to those who are not vaccinated. It's not yet certain whether a vaccinated person can still get infected with COVID and then pass it on to someone else. Remember that it's always been possible for people without symptoms who are infected with COVID to spread the disease. We know that people who volunteer to be in vaccine trials also are somewhat different than people who don't volunteer to be in those trials. And we don't know whether people who got the vaccine in the trials would have been more careful about being exposed or wearing masks or other types of social distancing things that may happen compared to people who are getting the vaccine now in the full population. Also, there's a possibility now that people may be spacing out when they're getting the vaccine in a different way than they were doing in the trial. So there are some differences between what's happening in the real world and what was happening in the trials. For this reason, there are now special studies that are being done. There's one being done at the University of Pennsylvania that are specially studying whether it's possible for people who have been vaccinated to go on and then develop an infection to COVID, whether or not they have the symptoms. This is all why, until we have more data, we encourage people who have been vaccinated to continue wearing the mask and observe the other social distancing measures. Soon we'll have new information and new data to be able to guide us about that. But until now, we should all go ahead and continue to practice the safest thing, which is wearing a mask, washing your hands frequently, not touching your face when your hands are not clean, and maintaining the 6 foot of social distance that we've talked about all along.
Thank you, Dr. Lemaster. So the next question is for Drs. Corvo and Areola. Could you tell us a little bit about what your organizations are doing to make sure that Latinos in your community have access to vaccine and related information, and what supports are in place for Spanish speakers? For example, when a Spanish speaker arrives at a vaccination site, how will that person be assisted? Are there interpreters available?
Erin, do you want to go first, or you want me to go first?
Sure, I'm happy to. Thank you, Sanmi. Yes, at the Wyandotte County Health Department, we're providing interpreters for people who come to the vaccination site. All of the forms that we have for you to read about the vaccine and such are in English and Spanish. And then we're trying very hard to provide information on our website that will be helpful to you, that is both in Spanish and English. We're also putting out some information on YouTube and other social media in Spanish, which Mariana knows a lot about because she's been helping with that. Thank you, Mariana. And so hopefully we're meeting your needs. I am very interested, if we're not, about hearing about that, because we want to make it easy for you to understand where to go and how to get the vaccine should you want to proceed with getting the vaccination. Over to you, Sanmi.
Thank you. In Johnson County, our primary approach to this and to public health in general is a view through an equity lens. So this is very important to us. So when you call us, we have Spanish speakers that are able to answer your questions. Similar to what Erin described in Johnson County vaccination clinics. We have Spanish speakers to assist you through that. Our online vaccine survey form has the Spanish version. And although we haven't gotten to that yet, but during the testing, we had partnered with El Centro and had testing clinics at the Good Shepherd Catholic Church. And so we have those plans in place where we use mobile clinics and other opportunities to reach out to our communities. And I echo a lot of what Dr. Castro and several other people said. There's a What this has done is really put a lens on the shortcomings of public health over the years. And one of the things that's obvious is the inadequate representation of the Latino community at the table in decision making. We've got to change that. Our approach to public health is building bridges into our communities, and I'm hoping that we get to do a lot more of that. When we had the lockdown, the critical workers that were there are mostly Latinos and other minorities. So when we have the vaccine, they should be at the top of our list. Not quite what we have, but just be assured that that's our primary lens, and we are continuing to work to ensure that we not only promote taking up the vaccine, but we actually make it practical, make it easy for you to get vaccinated.
Thank you, Dr. Cordova and Dr. Arreola. And for our friends, we're pasting here in the chat the links to access both in Johnson County and Wyandotte County, the surveys to receive information about when somebody can receive the vaccine. So please check those out. The next question is for Dr. Castro. We have heard that the Oxford AstraZeneca vaccine is not as effective in older populations and that it is made from chimpanzee blood. Is it true that it is not as effective for the elderly? And could you tell us what the origin of the Oxford AstraZeneca vaccine is?
Yeah, I hadn't heard all those rumors yet, but the vaccine is a adenovirus vaccine that uses a virus that infects chimpanzee to carry the protein, the spike protein of COVID-19. So there is no blood involved from the chimpanzee. It is only a virus that is can cause a cold in a chimpanzee or a monkey, but cannot cause does not cause disease in humans. So it allows the spike protein then, when it's injected in the muscle, to go into cells. Then your body builds the antibodies, the immune response to it. The first question about the elderly, the data that is best comes from the phase 2 studies. And the phase 2 studies suggest that the above age 65 do have adequate immunity elicited by the vaccine. And this is important because when we enrolled in the pivotal study, the phase 3 study, that we enrolled 32,000 participants in that study, over 500 here in the Kansas City area, with our partners that are on the call today, on the chat today. And we were successful in enrolling over 30%, 1 out of 3 participants above the age of 65. So it's going to be important for us to test it in a much larger population to know for sure that it's going to be protective in the elderly. But at this point, we believe it does.
Thank you, Dr. Castro, for clarifying. And the following questions we received from multiple sources. They're very important for our community. They're for Dr. Arreola and Dr. Cordova. Will the vaccine be available to everyone, regardless of their immigration status or health insurance coverage? And how can I enroll to receive the vaccine?
Okay. Okay, if I go first here.
Sure.
Yeah, first of all, I forgot to add last time that we're actually in the process of hiring 3 Spanish-speaking social workers to help us build better bridges into the community. So that's just recently been posted. So yeah, the answer to your question is yes, 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 yes. Come and take the vaccine. There are no requirements for health coverage. Your immigration status has no relevance to your obtaining the vaccine. Let me reiterate the point again. Whether you have insurance coverage is irrelevant. We want to get the vaccine into your arm. We want to get the vaccine into the arms of as many people as possible, as quickly as we can. And that includes you that's listening to me. then we don't ask you any of those questions. We just want you to be vaccinated. Now, the other question is, how do you enroll? If you call us at 913-715-2819, you will speak to a Spanish, you will get a Spanish speaking person that will assist you. Or if you send us an email, jcdhe@jocogov.org, we will reach out back out to you, or you can go to our website, jocogov.org, and you will be able to sign up for the online vaccine survey. There's a Spanish version there, and we track those. The response thus far is not a whole lot. We'd like to hear from you. Tell us that you want the vaccine, and that is the information that you provide is how we are able to reach back out to you when we open up appointments. Last time that we checked, the uptake is not very high. So go to that website, complete the vaccine interest form, and we have your information. So when we open up appointments, we can reach back out to you. Re-emphasizing that none of this matter, our goals are the same. You want the vaccine, we want to give it to you. Thank you.
Yes, and I'm happy also to add that in Wyandotte County, we're happy to vaccinate you regardless of documentation, immigration status, anything like that. Also, I want to add that all of the services are totally free. And so like Dr. Arreola said, we're just happy to see you and have you come in and get a vaccine if you would like to do so. I've placed in the chat for Wyandotte County a link that goes directly to the vaccine sign up page, and we have it both in Spanish and English, so you can go there and access that information. Feel free to fill that out. The information that you place in that is private. It will not be shared with anybody, especially no immigration authorities, anything like that. The other thing is if you don't have access to a computer, or you know someone in your life who doesn't use a computer regularly, feel free to just call 311. And the 311 line workers will help you sign up for the vaccine as well.
Thank you both. This is very reassuring. Dr. Corvo, while you're here, what type of documentation will be required to enroll or to receive the vaccine? And you already answered that information is not shared with immigration authorities, but we wanted to know exactly, is there a requirement to bring an ID or other type of documentation?
Oh, that's a good question. So when we ask you to sign up to get on the list to get a vaccine, we do ask about your age, and we do ask about your health conditions, and we wonder where you live and work. And the reason is because we get the number of vaccines into Wyandotte County for Wyandotte County residents. And so we just need to know if you're part of our county. And I think Dr. Arreola has to do the same thing. When you come into our vaccine site to receive the vaccination, you'll be asked again your name, your age, your information about where you live, and really some other questions about if you've ever had allergic reactions to vaccines. But otherwise, that's really it. Well, maybe some demographic information if you want to give it to us, but that's your choice. And so I don't want you to worry about any of that. None of the information is shared with other authorities. And it's only kept for safety reasons to make sure that you do well when you get the vaccine, because that's our hope.
And that is the same at Johnson County. All we're trying to verify is that you're a Johnson County resident or you work here. And right now, because qualification is largely based on age, it's 65 plus. So we'll need proof that you are in that age range. Otherwise, we don't need to know your immigration status. We don't need, we will also collect demographic information just to track things, but that's if you are willing to provide them. It's not a must. So it really is a very seamless process. And those information, in our case, we actually collect them ahead of time other than verifying your age. When you are booking an appointment online, you will have a documentation that there are basic information that we ask in our dispense assist so that we know, like Dr. Corvo was talking about, history in terms of allergic reactions or other things. Other than that, it's just verify that you are either a healthcare worker, that's showing us where you work, or that you're 65 plus. You get your shot and you're out of there in a few minutes.
Thank you both. Dr. Lemaster, now that there is a vaccine, why would it be important to continue getting tested for COVID?
Right, thank you for that question. In the health departments, we're seeing that a great number of the people that have been tested, that the number of people that have been tested has greatly decreased since the new year started. Those who are vaccinated may consider themselves to be immune and so may not be seeking to be tested. As I said before, it's still possible that vaccinated individuals could become infected and spread the disease. So if those who are vaccinated become close contacts of a known case of COVID, they should still quarantine for 5 days and be tested after 7 days to ensure they've not become infected. Because we don't yet know the effectiveness of the vaccines on the new variants that are coming along, those who become symptomatic should also be tested. Testing needs to continue as long as the pandemic is with us. It's one of the bases on which we will get the pandemic under control and eliminated. Please come and get tested, whether you're symptomatic or not. If you think you've been exposed or if you have symptoms, we have plenty of opportunities in the county, in the major hospitals for you to be able to get tested, and also in in your clinics where you see your doctor, it's also possible. So please come and get tested.
Thank you, Dr. Lemaster. While you're talking about testing, we have heard and learned about different types of COVID tests, including saliva-based, nasopharyngeal, rapid testing, and antibody testing. Are all of them effective? How do I pick one?
Thank you. Another good question. The gold standard, since we've got the testing swabs available after the beginning of the pandemic, has been the nasopharyngeal swab, the one that goes way back up inside your nose. But many people have found this uncomfortable. Now we have the Crl Saliva Tests that are available and in widespread use in Kansas City and in our health departments. These are just as accurate as the nasopharyngeal swabs for people who have symptoms. We don't know how well they work for those who may be infected but don't have symptoms because they weren't tested or developed with that in mind. So those who are being tested after an exposure but who don't have symptoms should still get the nasopharyngeal swab tests. Having said that, we know that even the nasopharyngeal swab tests are negative for about 30% of people with the COVID-19 infection. This goes down to about 10% after 2 swabs, serial swabs, one after another, but it's still not perfect. The rapid tests are not as accurate as that even. There are much more false positives for those who get tested than by using the nasopharyngeal swab. So those who are tested using the rapid diagnostic tests, when they're positive, should get a test to confirm it using the nasopharyngeal swab, or if they're symptomatic, they can use a saliva test, like I mentioned. We continue to receive questions about the antibody tests. These have improved a lot and are much more accurate, but they measure whether a person has had COVID in the past. The antibody test is most likely to be positive for a person 2 to 4 weeks after the person has been infected with COVID, so it's not helpful to us really in controlling the disease. By the time you become positive for the antibody tests, if you were infected and did not self-isolate, you may have already spread the infection to a large number of people. The antibody test is most useful in testing if a person has responded to the vaccine by producing antibody. However, we know from the vaccine trials that the anti-COVID antibodies increase to a high level and are protective about 10 days after you have your second dose of the vaccine.
Thank you, Dr. Lemaster. That was a great overview. So, Dr. Murad, if I already had COVID-19, do I have to keep wearing my mask? How long does my immunity to the virus last? Can I infect others during that period?
Sure. So when someone has acquired COVID-19 and hopefully, they recover, it's highly unlikely for that person to be reinfected within the subsequent 3 months. So if someone had COVID-19 within the previous 3 months, a lot of times we'll recommend that if they have symptoms again, they may not need to be tested again. Having said that, what's interesting is that, so we recommend masks and social distancing, and the number of influenza deaths this season has decreased dramatically from last season. So it's interesting in that masks and social distancing protect us not only from COVID, but from influenza as well. And it's actually sort of interesting because it brings up the question of, well, maybe you should do this every year during influenza season. So, so there's really no, to my knowledge, any recommendations that if you've had COVID, that you should not wear the masks and practice social distancing. We would recommend that you should.
Thank you. We have some additional questions here from the chat, and some of them are being answered in the box. I'm going to read some that are written in Spanish. So, if after having my second dose, I have symptoms, where can I get immediate help?
Mariana, I believe I typed an answer to that. Here's what I typed. If you feel really awful after your second dose, I guess I'm not too surprised. The second dose sometimes gives us worse symptoms than the first dose. If you feel like you maybe have a fever or chills and headache, this is common and probably related to the vaccine. If it's within that first 24 hours, take a day off, rest, take Tylenol, drink lots of water. However, if you have really dangerous symptoms like a rash all over your body, if you're struggling to breathe or you have wheezing or swelling, this is more concerning. And I would recommend that you go to the emergency room or if you have a primary care doctor, to call them and say, I need to see the doctor urgently. That would be even better. So seek care for yourself if you feel afraid, okay?
Thank you. So another question says, would a cancer survivor be a good candidate to receive the vaccine? Are there any risks?
Anybody? My answer is yes. Mario, you look
Sure
motivated.
Yeah, no. If they're a cancer survivor, likely, unless they've had chemotherapy or some other immune suppressant recently or ongoing therapy, then they're likely going to respond to the vaccine and should be protected with the vaccine. In the studies that we've done for the vaccine, though, those patients that are actively undergoing chemotherapy are excluded because the whole purpose behind the vaccine was to understand, could you develop antibodies to it or not? So right now we just have very limited information in that patient population that are actively undergoing chemotherapy. I know our oncologist approach is try to space out the vaccine from when your chemotherapy is so that your immune system has been reconstituted, but you should still get the vaccine.
Thank you, Dr. Castro. There's another question here. So are babies eligible to get the vaccine, or what is the age where they can start getting them?
The vaccine is not available for babies yet. We don't have a pediatric or kids vaccine. So for the Moderna vaccine, we vaccinate people who are 18 years old and up, and for the Pfizer vaccine, 16 years and up. And I believe that there are trials ongoing right now for vaccinations for kids, but we don't have that available yet.
Thank you. Have there been variant cases in Wyandotte County?
No, not to my knowledge. However, there have been 2 cases of variants identified in the state of Kansas, I believe. And I believe that was the UK variant that was discussed earlier on today.
Thank you. How long the vaccine protection will last?
Well, we don't truly know the answer, as Dr. Master probably can allude to. There's a lot of unanswered questions, and so we are actively following our patients that are participating in the studies all the way for 2 years to figure this answer out. Based on the data that we have from the outside of the US and other countries where they were impacted by COVID and had implemented not the US vaccines, but other vaccines, it does appear that immunity is certainly at 6 months, and we believe the immunity is going to last at least 1 year. We don't know if it's going to last longer than that, though.
Thank you, Dr. Castro. And I do realize that it's 8 o'clock and I want to be respectful of everyone's time. I know we still have a few questions here in the chat. I think that the ones that we have 4 questions. I think you have already answered them. So Father Gianni, would you like to share a few closing remarks?
Only to thank everybody, especially the panelists and Juntos that organized this roundtable or panelists to answer all these questions. Thank you very much, because yes, especially the Latino population need all this information, and I hope that we can continue with what we learn to spread the news about especially vaccine. So thank you very much to all of you, and thank you for all the people who followed us today in several ways. There are I was looking at the numbers, but more than 50 people that were following the Zoom, and then there is also YouTube and Facebook. So I really hope that many people took advantage of this situation, of this opportunity. So thank you very much. And they told me that now closing this event, there are going to be some advertising or an announcement, in a sense, the people who are participating, their addresses and the resources that you can use to have all this information in your computer and available to you. And thank you and have a nice evening. Entonces, también en español, muchas gracias a todos los que han participado a este panel y a esta mesa redonda de respuestas que necesitamos por nuestra comunidad, especialmente latinoamericana. Y le estoy dando las gracias a todos los panelistas por su tiempo y por la asociación Juntos que nos ha invitado. Muchas gracias.
Muchas gracias, Padre. Y vamos a poner las preguntas que quedaron pendientes, se las vamos a preguntar a nuestros panelistas y vamos a poner las respuestas disponibles en el Facebook de Juntos para que